our class today, I'm taking in general proctology, but our main focus will be lasers, how to use them in fistula and ano and fissure. First we'll discuss some common anorectal disorders. I am Dr. Shagun Agarwal, and so our learning objectives would be understanding the basic anorectal anatomy and physiology, diagnose some common proctological conditions, how to do it clinically, describe their medical, office-based, as well as surgical management options, identify the red flags that will require further evaluation, like we were discussing in our colonoscopy class, and apply principles of patient-centered anorectal care. So proctology deals with anal canal, rectum, and the perianal region as well. So as general surgeons, as GI surgeons, these three things can, if you master these three things, you're a proctologist. And common conditions of proctology, hemorrhoids being most common, rest anal fissures, perianal abscesses, fistulas, pilonidal sinuses, rectal prolapse, and certain functional disorders. And we'll be discussing about all of them with basic focus, with special focus on the lasers in the management. About anatomy and physiology, so anal canal is around 3 to 4 centimeters in length with a pectinate line present at 2.5 centimeters from the verge. So this dentate line basically lies somewhere towards the rectum, and it divides the visceral innervation, which is present above the dentate line, and it has only visceral supply, that is sympathetic and parasympathetic system. And hence, when the bleeding happens from any disease or any disease present above the dentate line is painless, whereas below the dentate line is somatic innervation and is pain sensitive. So this is something that we'll be discussing later on while we're discussing the diseases. The internal anal sphincter is the smooth muscle, and the external is skeletal. So internal is not under our control, it's under the control of pudendal nerve. S234 maintains the pelvic floor, as they say. So internal anal sphincter is smooth muscle, not involuntary, and external anal sphincter is skeletal, so it is under voluntary control. So this becomes important in the continence aspect. And the puborectalis skin sling, which comes from the pubic symphysis, goes behind, turns around the rectum, and then goes back again and inserts in the front. This gives basic continence, so that any stool that collects in the rectum just doesn't pass off immediately. It gives that basic continence. And internal and internal sphincter, they give additional continence to the puborectalis muscle sling. That's the basic anatomy. It's been borrowed from the Cleveland Clinic. So this is the dentate line that we are talking about, the anocutaneous line. And this is the dentate line. That's the anocutaneous junction or the anorectal junction. Certain sinuses are present above the dentate line along with the columns. Above this is the columnar epithelium, below is the somatic, and at the pectinate or dentate line is the cuboidal epithelium. That's the puborectalis muscle, and that's the anal, that's where it starts, the canal, and then the rectum starts. That's the external sphincter. This is the internal sphincter, and all these diseases happen around here. So this is where all the diseases that happen we'll be discussing. About continence and defecation physiology, so we discussed about anatomy, now a little bit about physiology. So continence depends upon the internal sphincter tone, the external sphincter voluntary control, the rectal compliance, how much it can distend, and the sensory perception, if the patient can perceive that the rectum is distending now and feels the urge to pass. And how does this defecation happen? The moment rectal distension happens, this rare reflex happens, which gives the continence to the brain. And then a patient with a sound mind with social inhibitions will find a washroom to go and pass. Puborectalis relaxes, and the internal abdominal pressure increases to make the stool pass. Finally,
Pain, bleeding, or discomfort should never be ignored. Conditions like piles, fissures, and fistulas are more common than you think. Proctology is a specialized field that offers advanced solutions for anorectal disorders. With minimally invasive and laser-based treatments, recovery is faster and safer. Early diagnosis can prevent complications and reduce the need for major surgery. Expert care ensures precise treatment with minimal pain. Do not delay your health. Consult a proctology specialist today.